Good morning to all. Myself, T. Prabhu, Assistant Professor, Department of Pharmacology in SNS College of Pharmacy and Health Science. Today we discuss about case study of tuberculosis. Definition: tuberculosis is a chronic granulomatous disease caused by Mycobacterium tuberculosis. It is mainly affected by bronchi and lungs. What are the symptoms of tuberculosis? The symptoms of tuberculosis is mainly present in cough. Cough means the chronic cough or with in blood. Sometimes it may be overflowing of cough will throughout the blood body. Fever, loss of appetite, fatigue, sweating of chest, shortness of breath, severe unintentional weight loss. Right. Next, diagnosis. How will diagnosis the TB? Because first line of TB cases are mainly identified by blood culture of MTP test, which is the suitable mycobacterium growth indicators. So how can mycobacterium will be present in the blood to the syndrome? Then the mycobacterium level is high, the TB will be find out the first line of diagnosis. Next, CBC. CBC means complete blood count, which are MHC, MCV, total blood count. Another is RBC or WBC or platelet count. Many other platelet count will be to identify how the infections are affected to the blood. Then X-ray of chest PAV. To survival of lungs, between clear image of the chest, it will be moisture to admire in the surface area of lungs. To entire the mass is seen, it will be find out the TB is diagnosis. Okay. Next, sputum test. When through split out the sputum culture, it may study of sputum smear culture study will be carried out. The sputum will be elaborated and estimate the characterization of mycobacterium growth. The WBC will be increased, will be producing a leukocytosis. There is nothing but the TB is when affected a person, then automatically WBC count will be increased. So they can cause us leukocytosis disease. Next, treatment. The first line of drug. First 6 months, the patient will be orally intake the drugs of antibiotics like isoniazid. The first 3 combination of drugs in rifampicin, pyrazinamide, ethambutol. In case of IP, the IV fluids are also taken the patients. It is necessary for the patient will recover for quickly and it will be avoided by the dehydration. Then antibiotics, moxifloxacin 400 mg IV BD, levofloxacin 100 mg IV BD, ceftriaxone 1 gram IV BD. So these are the first line of drugs. In case of first line of drugs may be passed through the after 6 months. Okay. Next, second line of drugs. Second line of drugs will be carried out like amikacin 500 mg IV BD, ciprofloxacin 100 mg IV BD, and moreover essential for the IV fluids like oral, EM, NS, DNS, etc. So what are the common mechanism of action of TB? The tuberculosis is transmitted through the air. A person inhales the droplet of nuclei containing Mycobacterium avium. The nuclei travel the mouth or nasal passages, upper respiratory tract to affect the particular area of bronchi to reach the lungs. May have the higher antibiotics of streptomycin 1 gram IV. It will be interfere the protein synthesis to inhibit the transcription of mRNA. The drugs are most effective and least toxic used for treatment of tuberculosis. Thank you.